Assalamu alaikum. My name is Muhammad Awais and one of the assistant professor in pediatric department Akhtar Said Medical College. Hopefully you are doing well. Today's topic is child abuse. So these are statistics from Pakistan. Child abuse is not only present in West but also in countries like Pakistan. And you can see the figures from 2018 2019 reported in Islamabad. Uh, Child abuse cases boys from 2018 and from 2009, which has increased uh, significantly. And the girls are the same. And child sexually abuse, we see boys in 2018, this blue chart, and 2019, this orange chart. Number of cases reported actually have been increased so much in 2019 of sexually abused boys, and in case of girls, um, the cases are less in 2018 and also less in as compared to boys, but this can be due to the underreporting and the cultural and social reasons. Uh, there are also cases of murder after sexual abuse, like in girls. There has been trend, but also in boys it has been seen that the abuser is unfortunately murder on the child after sexually abusing. Any act of commission or omission by individuals, institutions, or society as a whole, and any conditions resulting from such acts or inaction which deprive children of equal rights and liberties and/or interfere with their optimal growth constitute by definition abusive or neglectful acts or conditions. So this is the definition, which is and analyze it like any act of commission, any actual act or omission, or any behavioral act by individuals, not only individuals but institutions or society as a whole, and any conditions resulting from such acts or just behaviors which deprive children of equal rights and liberties and or interfere with their development uh, physically and mentally constitute by definition abusive or neglectful acts or conditions. The number of reports of child abuse or neglect has steadily increased internationally and also nationally since mandated reporting to services in law enforcement agencies. Child abuse is seen in any part of the society, but it is most common in underprivileged lower socioeconomic class. But it is underreported in this class as well. What are the risk factors? The main risk factors are parental separation, divorced parents, poor parenting skills, and parental disharmony, conflicts within the family. How would you recognize a child abuse and neglect case? Definitely, the importance of history examination is also here. In history, the history would be discrepant history, like it means that your examination not clinically correlate the historian are given. There would be delays in the seeking of care, like there would be many old bruises or fractures you can see while evaluating the child. You can find out certain event or behavior by the child that triggers a loss of the parent, like colicky baby. They're very much crying all the time in the days and nights as well, and parents usually react sometimes in a different way. History of abuse in parents' childhood, like the parents who are abusers or the foster parents, stepmother or stepfather, who sometimes they have a history of child abuse in their own childhood. Inappropriate effect from the parents, pattern of increasing severity if no intervention, social or physical isolation of the child or the parents, and if there is any stress or psychological problem or financial crisis in the family or the parents. Sometimes unrealistic expectations of the parents for the child can cause frustration from the part of the parents and can cause harm to the child. Examination, a complete, thorough, attitude examination is important because a history may be misleading and unexpected illness may be detected. Documentation of present and past growth parameters is an essential part of any pediatric examination. So there would be a rapid decline in the growth of the child, especially who are being abused physically and mentally. Lack of clean clothing. If you check the clothes of the child, there would be poor hygiene, nappy rashes, and other ill health problems. Child's behavior would be different in the examination room. If you check the skin, there will be abrasions, alopecia, bites, bruises, burns, dental trauma, fractures, lacerations, ligature marks or scars or cigarette burn scars, well demarcated, rounded scars. Injuries may be in multiple stages of healing. Some will be old, some will be new bruises. In sexually abused children, we should also, if we suspect sexually abused children, we should check genital and anal findings as well. And classification: physical abuse, sexual abuse, and emotional abuse. Physical abuse is quite common. It is called non-accidental injuries as well, because these are not accidental but non-accidental or intentional use of physical force on the part of a parent or the caretaker interacting with the child in his care aimed at hurting, injuring, or destroying the child. The history is incompatible with the child's injury. Child abuse should be suspected and reported. It is also suspected in a child with multiple injuries or injuries in various stages of healing. The most common physical abuse injuries include multiple bruises, burns, abrasions, bites, black eye, subdural hematoma, and bone fractures, like depressed skull fractures or bilateral acute long bone fractures, uh, like sternum fracture. Other fractures are common. Physical abuse is most likely when a high risk parent is responsible for the care of high risk child. High risk parent could be a psychological patient, and the parent could be having any financial crisis, or some conflicts among the parents as well. The high risk children would be like handicapped child, and like babies who are always crying, the colicky babies, and babies, children who are neglected child. Sexual abuse. Sexual abuse involves a child in any act that is intended for sexual gratification of an adult. The definition of sexual abuse includes inappropriate exposure to sexual acts or materials, passive use of child as sexual stimuli for adults, child pornography, actual sexual contact of children with adults. A child's apparent consent to participate in sexual activity does not reduce the older person's responsibility or alter the diagnosis. Emotional abuse. Emotional abuse includes intentional, verbal, or behavioral acts that result in adverse emotional consequences. Emotional neglect occurs when a caretaker intentionally does not provide nurturing, verbal, and behavioral actions that are necessary for healthy development. Emotional abuse includes rejection, isolation, criticism, or terrorizing of a child. Emotional abuse is usually difficult to document because it's not physical trauma or something, but it's a mental trauma or the bad behavior from the caretaker who can definitely cause problem to the development of the child physically and mentally. What could be the causes of child abuse? Like abusers childhood means like many abusive parents report having suffered what could be labeled as emotional abuse during their own childhood. Family stresses and sports. Excessive stress on the parent or family causes a breakdown of inhibitions and release of frustration on a child. Main stress or death or serious illness of a friend or family member, serious financial difficulties and conflicts in the workplace. Lower job status and educational level may be associated with increased rates of child neglect and sexual abuse. Maternal age: the less is the maternal, the more likely the risk of child abuse. Although the abusers as a group do not fall into any single psychiatric diagnosis, some patterns of mental illness have been associated with certain kinds of maltreatment. Early parent-child interaction. The period immediately after birth is a critical period for the formation of parent-child relationships. If a bond between the two fails to form at this time, mother will not be motivated to adequately protect and nurture her child. Um, Characteristics of children at risk of abuse. Increased rates of abuse have been reported among handicapped children, children who are socially and emotionally isolated are higher risk for sexual abuse. How we could manage these cases? Physical abuse, injuries, sexually transmitted diseases, and medical sequelae of neglect should be treated immediately. Uh, Children with failure to thrive related to emotional and physical neglect need to be placed in a setting where they can be fed and cared for. Child in danger of recurrent abuse needs to be placed in a safe environment. If abuse or neglect is suspected, a report must be made to local or state agency designated to investigate such matters. Thank you very much. If you have any question, you can ask on the YouTube channel in the comment section. Thanks.